Alrighty, good evening to all of our attendees within Special Olympics Kansas. Thank you guys so much for coming out to the Special Olympics Kansas 2020 Virtual Health and Leadership Forum. So tonight is the first night of 2 days that we are going to have a number of speakers here. And you also don't want to miss any of our speakers, because if you do, you are missing out on a chance to win an Xbox One X. So each time you attend a session, you'll be entered into that prize drawing for the Xbox One X. We also have prize drawings for each speaker that you have attended, and we will also have bingo tonight after our keynote speaker, Dr. Alicia Vizano. So Dr. Alicia Vizano is with Special Olympics International, the entire world, and she has been working on a movement called Inclusive Health, which we will get to later. So first, I have to tell you guys about also our mission sponsor for Special Olympics Kansas. They have been great partners with us. They are also Special Olympics new partners, and that partner is United Healthcare. They have provided us with a lot of great resources and partnerships to work with them. So send a thank you to United Healthcare, and also don't forget to send thank yous to your speakers as well. So to begin our evening, Becca has a bio of Dr. Bazzano. Can you go ahead and read that for us, Becca?
Good evening, everyone. My name is Becca Henderson, and I had the pleasure of meeting our keynote speaker at Athletes on the Hill Day in Washington, D.C. Let me introduce you, Dr. Alicia Vizano.
Hi, everybody.
Wait.
Thank you so much for having me.
Yes. Becca, can you read the bio from Dr. Bazzano, please?
Yes. Dr. Bazzano is a pediatrician and a public health executive who has dedicated her career to improving the health of people with intellectual disabilities. Dr. Bazzano is responsible for providing strategic oversight of all health activities around the world to ensure public funding policies, medical training programs, and health service delivery are inclusive of people with ID. Dr. Bazzano has been published and cited in leading peer-reviewed journals and has been awarded foundation, state, federal, and international funding to design, implement, and continually evaluate programs for children and adults with development disabilities. Please welcome Dr. Bazzano.
So thank you, Becca. And just as a reminder tonight, for our interview between President and CEO of Special Olympics Kansas, John Lair, and Dr. Alicia Vizano, we are going to have you all stay on mute tonight. If you would like to ask a question to Dr. Bazzano, please type that in the chat and we will be able to read those off to her at the end of the presentation. So everyone, please welcome a very silent welcome with your muted mics for Dr. Alicia Vizano. Thank you. Take it away, John.
All right, great to see you again, Doctor. I'm going to start off asking you some interview questions, and we truly appreciate you being on here, and you're such a rock star for Special Olympics, and we truly appreciate you being on here tonight. Number one question. Special Olympics Kansas is striving for a culture of inclusive health. Why inclusive health?
There we go. Okay, thank you. First of all, I just want to say thank you to you, John, and to Becca. Thank you for my introduction too. There's a lot of what's in that introduction is kind of a lot of the parts that I think people traditionally think of, but they don't, but I don't know. I think introducing me as a parent, as a supporter of Special Olympics in Southern California, which is where I started, and especially as a person who really wants to see that people with intellectual disabilities are treated with the same respect that people without intellectual disabilities get. And if I were to say what inclusive health is, it's that mission. It's to make sure that people with intellectual disabilities have every opportunity to be healthy, and that they can take full advantage of all the same programs, all the health programs and services available to people without intellectual disabilities. And so that ultimately we don't have these big gaps in how long people live, and that we don't have these gaps in the health services that they get, and that we don't have these gaps in the health disparities, right? So we know that people with intellectual and developmental disabilities have a lot more health conditions. You all know this and you see this, and you know that there's a 16-year life expectancy gap from preventable causes. And so that's why we need inclusive health, because when you get to a place where there's equity, where everybody gets to have the same kinds of resources to be healthy, then we will get to everybody, that decreasing that gap. And we're working on that. We're working on that throughout the lifespan. And that's what we do, everything from the young athletes to the fitness, to the training of the healthcare workforce. When you're at Healthy Athletes and the doing the screenings, that's so you can detect things early and address them early. But it's also so that medical professionals, health professionals learn how to be inclusive. And then really also, we've seen this especially during COVID, people with intellectual disabilities need to be included in all the responses for any kind of, whether it's a public health emergency and pandemic, or whether it's public health prevention. That when you're working in health and healthcare, that you need to have a thought for people with intellectual disabilities. You need to put that into your policies and into your thinking. And that's what we've been doing for quite a while in the healthy communities. And that's what we certainly are doing during COVID, is to make sure that people with IDD don't get left behind or left out.
Great. Got a second question for you. What are some common barriers that our athletes face in healthcare?
Wow, you know, I think about this. If you are trying to seek out healthcare, and the first thing is you have to recognize your own symptoms, but somebody else often needs to also help you along the way to be able to get to care. That's often, you know, that can be potentially others in your circle who you need to communicate with. So first of all, others don't always communicate very well with people with intellectual disabilities, and they don't always seek to understand. So there isn't enough communication, and certainly even before you get to the healthcare setting, when you're anywhere in healthcare. So the front desk staff need training on how to communicate. The ambulance needs training on how to communicate. And certainly in my profession, pediatrics, we can do a better job as well, but everyone from the front end all the way through the specialty care need assistance, because communication is a huge barrier. Things like inaccessible materials. So, you know, when I'm sitting here looking at the the information that I'm get, when I broke my ankle and I'm sitting there and I've got this whole page, like 6 pages on what I'm supposed to do for physical therapy. That is inaccessible to me, and it's inaccessible to somebody with intellectual disabilities. So our materials need to be changed so that they are accessible. Our spaces need to be welcoming, and they're not. We have very poor education for health professionals. I will tell you that I went to med school, I went to residency, I did all this training. How many lectures did I get on intellectual disabilities? 0. How many, zero, literally. And now, at my own alma mater, still, how many lectures do people get? 2. It's because I give them, and that's it. And that's more than 20 years later. We definitely need to train up all of the healthcare workforce. And that's a big gap. We also don't have very user-friendly systems. So whether it's the transportation, and it takes a lot to get places. I mean, even think about COVID testing. COVID testing might be inaccessible to a person with IDD because of lack of transportation. If it's drive-through and you don't have a car, it might be inaccessible because you're not prepared for the type of testing that is. It's inaccessible because you're not given good follow-up instructions and communication. And it's inaccessible also because of a lot of really difficult funding stream issues. I mean, you guys are in Kansas. I don't know well enough the healthcare system in Kansas. I do know that your neighboring states certainly have challenges with Medicaid waiting lists, with not being able to see specialists, with once you get to a specialist, honestly, them not being able to communicate well enough, or giving you medication for behavioral issues, but not actually addressing the medical issues. I mean, those are all the big barriers, and they start with, before you get to the healthcare system, not even getting opportunities to be healthy. And then once you're transportation there, and then once you're there, the lack of communication and materials, and then even trying to get the follow-up. I mean, it's all 4 of those areas that really still have a lot of barriers. Doesn't mean we can't work on it, but there's a lot to get to healthcare.
Great. 3rd question, how was the inclusive health movement started?
This is a great question. So I don't know how long everybody's been around Special Olympics. I know I haven't been around that long, and I'll digress for a second and tell you how I got to know Special Olympics was actually through some of the global clinical advisors. And I got to go to, and in 2015, I got to go to the LA Games because I was living in California. And I went, and I went with my kids, and they were like 5, 7, and 9 at the time. And we were in the stands with 70,000 people. And we have Nadia Comaneci, and then a Special Olympics athlete. And then we have Bart Connors, and a Special Olympics athlete. And they're all coming up to the stage. And my kids thought that they were at the other Olympics. They did not realize that there was any difference between the Special Olympics and the other Olympics. And I was thinking to myself, man, that's the way it's got to be. That's the way we should be. And then I was like, oh my gosh, I've got to start. I've got to join. I've got to be part of this. So that's when I became a clinical director in Southern California. And in getting that training, it became so apparent that and this is what Special Olympics, I think, realized back in 1997 is you can't be an athlete unless you're healthy. I mean, that's really the key, is that to be expecting people to come up and play basketball when you don't have glasses and you can't see where the ball is, or to be expecting you to to, you know, be able to do a run at a starting line and a sprint when you can't actually hear the starting pistol. I mean, both of those things are just the beginning. But if you're in pain, if you've got a mouth abscess, if you've got high blood pressure, and it's just from head to toe, if you have, you know, foot injuries or abnormalities, you can't compete at your best. And I think that's what Special Olympics realized back in 1997. That's when they started all the screenings that are being done. And, you know, so far it's more than 2 million screenings. That started it all off. And then in 2012, we got the gift from Bazzano Foundation to start the Healthy Community. So it wasn't just at events. It wasn't just at the big events that you got the screenings, but this was really embedded, you know, and continuous. So you get screenings in other places, at other times, with the community health centers, and then you can actually go there for care, because before we were kind of giving you a diagnosis, but then we weren't actually helping you get treated. So now we do that as well. And then expanding that to having ongoing fitness and the ongoing health promotion classes, and the training and the curriculum change. That's all how we developed out to the healthy communities that are now in 104 countries. And really it was the CDC and the Bazzano Foundation that provided a lot of support for us to be able to do that kind of over time. So where we started with at the events, at the big, you know, the big games, now we really are embedded, and I hope to see going forward even more at the local levels. And whether that's at small events, at small competitions, whether that's in the schools, I'd love to see us do more at the schools. And right now, I just found out yesterday, we're in 1,139 schools have health programming in as part of their Unified Champion Schools.
Wow, that's impressive. Question number 4, what are some of the challenges that you've overcome with inclusive health?
Thank you. So I think I started to mention a lot of the barriers. So things like not having communication, not having follow-up care. And that we've done a lot with our healthy communities. But I'll answer this way in terms of what we have tried to do with and for athletes. It's to develop advocacy skills for yourself. So to be able to, yes, to be able to access health care, but especially in the first place, to just be able to access healthy habits and healthy lifestyle, so you don't even have to go to care. And then once you're there, our health messengers, for example, we have over 4,000 health messengers. I know there are some great health messengers in Kansas that are smiling right now, in fact. So I look towards if we can make sure that everybody feels empowered to work towards their own health goals. That's a big help, especially going into the screenings and the follow-up care, and really giving that ongoing health education. So we know in our fitness programs that you guys have, and in our health promotion programs that you guys have, that when you are in our programming for at least 8 weeks, those people who have high blood pressure actually reduce their blood pressure, and 17% go from high blood pressure to normal blood pressure. That's huge, because that very much helps your health on the front end, so you don't even have to get into care. And then when you're in care, we really are working so hard to train up health professionals to be able to deliver the care to you, to people with intellectual disabilities, in a way that is high quality and respectful. And then in terms of some of the barriers that we've addressed, both in the US and internationally, we've worked with public health departments to make sure that they are thinking about including people with IDD. We've worked with health systems at like the American Heart Association, for example. They now are doing training that includes people with IDD. They never had thought about people with IDD having heart disease before. And now they do. The CDC, for example, has been talking to us about CPR and whether we can train up our athletes for CPR. So lots of different ways that we're including people with IDD and really trying to get to better health, first of all, before you get into health, and better health care once you're there.
Great. Question number 5. What are some results or impacts that you've seen from inclusive health?
So I mentioned the blood pressure already. I will tell you over 95,000 athletes have been in the fitness programming. And we did a study where we looked at if you have high blood pressure and you're in fitness programming versus not, 17% go to normal. The thing that I didn't tell you was that going from a high blood pressure to a normal blood pressure adds 2 years of life onto your life expectancy. And it actually saves money too, because in the healthcare system, to have a diagnosis of high blood pressure and to be treated for that, it costs about $3,450 a year. So that's one example. The other example that I can give you is in healthy athletes, when you go to the screenings and then you get the follow-up, 51% of those athletes who were screened no longer need urgent referrals. So we're getting to over half the athletes, after they come to the screenings, they get the follow-up care, they don't need referrals anymore. 61% no longer had high blood pressure, and 67% no longer had mouth pain because we're taking care of it there. So those are just some examples. It costs about $100, $98 per athlete to go through the screenings. But because we get so much volunteer and support, we can actually give about $1,000 worth of care. So just think about one bone density screening that we do, which we of course do for free for the athletes. It costs, if you were to go to a doctor, it would cost about $125. The fluoride varnish that we give, again, that usually costs $75 to $80. And that's just 2 examples. So we're able to show a lot of impact, especially for a small budget that we have. And you guys amplify that even more when you bring on your health partners that give equipment, that give support, that bring in the health systems to train the students and so forth as well. The last example I'm going to give you is on young athletes. Because young athletes, as a pediatrician, I think of this as the way to have a healthy start, is to start with young athletes and be really throughout the lifespan. Special Olympics can be a health partner from the very beginning all the way older to older age. And the young athletes is amazing. And just in 8 weeks, you can actually see 7 to 9 months of motor skills gains for those young kids. And what a joy and a treat it is to be able to see that. I know I volunteered in young athletes in Southern California as well. And you guys, I'm sure know just how incredible it is to see those young children who start off maybe not even walking, but then really running by the end.
What is your favorite memory or story of an athlete within inclusive health?
So I'm actually going to tell you a story about young athletes. So I was working. So I was in Southern California at Young Athletes with this lovely mom, and she had a little 5-year-old girl named Millie, and Millie was very sweet, and as I was looking, she was doing okay. Kind of moving along, motoring along on the obstacle course, and she'd come every week. And I would look, and she'd always have a very sweet smile. There was just something about her features that looked different. they just didn't look quite like her mother. And so one day we were talking about, health, and her mom was talking to me about how she'd get sick quite a bit. And she'd have a lot of pulmonary infections and other kinds of infections. And I was sitting there and thinking, I wonder if something else is going on. And I was able to connect her up with some of the other folks in Southern California who are clinical directors for healthy athletes. And we were able to get her some really important care that she needed, that she wasn't getting from her general pediatrician, from her regular pediatrician. She was going and she was getting her shots, and yeah, you're behind, but let's just see how you go. And we were able to actually get her through the healthy communities. We were able to get her to a geneticist. And that geneticist found out she actually had a rare genetic condition, and that she could actually be treated for it. So she, just by coming to the young athletes and being part of that, she actually got so much further than she had in her 6 years, because she could have actually been treated as an infant. And it had just been missed over time and missed over time. And when you get people who are trained, when you get people who understand how to navigate a system to get to the care that you need, then she Millie's doing so much better now, and it's 4 years later. She is thriving. She's on some medicine that's helping her quite a bit. And her younger brother has the same syndrome, and they were able to pick that up super early. And that was because we had people who were on the lookout for it, who were trained, where her mom had gotten a whole bunch of closed doors before. No, she's fine. She doesn't need genetic testing. No, she's just delayed. No, she doesn't need this. Where we were able to open the doors. And that's what happens when you have inclusive health. People who are trained, the doors are opening. And I hope we can do that for so many, many other people. I know that there's a long way to go with that. And I'll tell you, for example, one of the athletes who I work with just last week said, hey, I had fever. I was checking them. Hey, I had fever and I wasn't feeling well at all. And my doctor, and I said, oh, did you call your doctor? Did you get a COVID test, right? Because everybody and their uncle should be getting a COVID test if you have fever and you're not feeling well and your bones are aching and everything and you can't get up. And she's like, yeah, no, my doctor said that I should stay at home, that I should wait at home. Really? I don't understand that. And I see that often. I see often that people with IDD their symptoms are not taken seriously, like people with who don't have IDD. And that's what was happening with Millie, and that's what happened last week. So I truly believe we have to do more to be able to get people to the care that they need, to be able to get the health professionals trained up. And the best way to do that is to show is to assist the athletes and families in advocating for themselves and to train the healthcare workforce ourselves.
Great. Who can be an active member of inclusive health?
Oh my gosh, I hope every single one of you who I'm talking to is an active inclusive health advocate. And where I'm looking to go in the next 10 years is that we need everybody. We need the coaches to think about health as part of coaching. We need the families to go to the family health forums and connect each other. We need the healthcare professionals to be trained, and the athletes need to be at the forefront, both in serving as mentors and serving as advocates, just like Becca, and so many others, and teaching the health professionals how to take care of them. And that's really what I want to see us doing. And I also want to see more of that Capitol Hill Day. Right now, one of the things that I think that we all need to be doing is advocating for people with IDD during COVID, so that they're not left behind, so that they are getting the testing. Everybody who needs testing should be getting testing. Everybody should be getting masks and social distancing. You should be able, and they should be getting treatments if you get COVID. And I just want to make sure that everybody with IDD, even, and also during vaccines, when we get a vaccine, people with IDD shouldn't be left, behind. That it's a high-risk population. We need to make sure that that all the high-risk populations are treated the way that they need to be to prevent deaths in COVID and beyond.
How can someone become actively engaged in inclusive health?
Oh gosh, so there are a lot of ways. Some of those that I just mentioned, right? So promotion of health opportunities that are inclusive before you even get to the hospital. So inclusive fitness. My gosh, we now have School of Strength. Do you know that it is ridiculous that, think about how many workout videos there are? Hundreds, thousands of workout videos. I mean, I'm dating myself here, but I remember Richard Simmons. Nobody until School of Strength ever did a workout series for people with IDD. That's crazy. But that's just one example. So spread the word on fitness. Use the videos. Use your own sports practices to be able to talk about health, talk about fitness, advocate even in that setting. And then the next thing is, once we get to health settings, trying to help our athletes and families to be able to advocate for themselves, and then trying to train up the healthcare workforce, which is a job of everybody, and then really also employing our health messengers, employing people with IDD who in all these kinds of settings that are meaningful roles. And then where I think that the society needs to go is we really need to be measuring health for people with IDD as compared to people without IDD. And we do that with our data, but the whole country needs to do that with CDC and beyond. The globe needs to do that. And then just like we have in CDC, we have funding to promote health. That's only one country. We really need to be able to be doing that in each state much more clearly, and then in countries all over the world. Those are all different kinds of ways that we can promote inclusive health. And I would also say we have a number of videos and resources. So on resources.specialolympics.org, there's a lot, and also learn.specialolympics.org is our learning portal, and there's videos on inclusive health. You can get trained up. And one thing you could do is actually ask your own health provider, are you inclusive? Have you done a training? Go to learn.specialolympics.org. Because I think when you do that, then you can actually get some movement on this on a big scale. Every healthcare provider takes care of somebody with IDD.
Where can we find an inclusive health setting?
I hope you can find them all over, and if you can't find them, then I hope you can create them. So your doctor's office, your own doctors, but any doctor's office should be inclusive. And if they're not right now, you can help them become inclusive. You can help them with their communication skills. You can help them make it warm and welcoming. You can help them send them to learn.specialolympics.org so they get trained. And you can help them even in their policies themselves. I'm going to give you one example because I created an inclusive health center in LA. It's a community health clinic, a free clinic for kids and adults with IDD and without IDD. So half of the patients have IDD, half of them don't. But we did things, we thought like a patient. I thought like if it were my son, and he has to go in. So he's sensory issues. So we made sure that if we're running late, we text you on the phone and say, hey, you can wait in the car. We're running a bit late. You don't need to come in and wait in the waiting room. Then the whole space was designed by a parent who happens to be an interior designer. Awesome, because it's spacious, it's not too cluttered, it has some sensory, art on the wall that you can touch. The lights are covered, the fluorescent light cover, so you don't get that, that terrible fluorescent lights. And then you go in and everybody's trained. And my office doesn't look like an office. It actually just has a table. It has a sofa from IKEA. So it doesn't actually have a scary exam table. And it's got, a washstand to wash my hands. I don't wear a white coat. When you go in, it feels much more like home, right? It's got a rug, a beanbag chair, a light. It just feels more warm and welcoming. And then we're all communicating both verbally, non-verbally, with boards, with communication boards. We have lots and lots of pictures, the way that we've created those takeaway materials that you get that, I don't know, I told you 6 pages of things that I was supposed to do that I didn't get. But we're creating ones that don't even have many words at all for those who need communications that's much more visual. So those are just a few examples. We also make it much easier for follow-up visits. So that's a doctor's office. Your gym could be inclusive as well, making sure that it feels comfortable for a person with IDD going into it. And right now, nobody's going to gyms because of COVID, but certainly that's something that, in certain places, but certainly that's something that we can work on now to make the machines accessible to do the same things. You don't have to be afraid of the machines because there are visuals that help you use them. You don't have to be feeling uncomfortable or not confident because people don't seem accepting of you who are the gym staff. I mean, these are all easy ways to be more inclusive and to promote inclusive health.
Great. I just have one final question. I put you through the ringer, so I apologize.
Not at all.
What are some best practices for implementing inclusive health?
Well, I kind of think I probably answered that. Really it's about having warm and welcoming spaces. It's about training, it's about communication, and it's about preparing. If you just do those 4 things, you've done it all. And I will say that, just working with Becca, working with you, John, it's very, very clear that that the healthcare system underestimates people with IDD all the time. And if there's any message that we can bring, it's stop seeing the disability and see the ability. And if we can, if I boil it all down in terms of being inclusive, it's just treating everybody like a person with abilities and dignity. And I think if we get that message across, sometimes you have to change that message, the way that you say it, because certainly there are a lot of doctors who are not so down to earth. I'll put it that way. But if we then also bring the data to them and, it's a combination of just have the people in front of you who you can see and understand and connect with. And then understanding that, look, people with IDD have serious disparities, that there are serious reasons that are preventable for dying 16 years early, and that you can do something about it. I think that's how we get the message across. It's a lot of work to get it done, but I think we can do it.
That's great. Yeah, I can't thank you enough for doing this with us tonight. I saw firsthand, myself and Becca out in DC, just how vested you are in Special Olympics for all the athletes. And, here in Kansas, we're definitely pushing in the right direction, doing lots of great things, but wanted to really thank you for taking time tonight and answering my 10 questions. I know like I said, I put you through the ringer a little bit. So I appreciate you kind of answering all of my questions. So thank you so much.
I so appreciate that. And I'll just tell you, I'm not stopping until people with IDD live just as long as everybody else and don't have these preventable deaths. I'm not stopping until everybody can have the opportunity to be healthy. And I hope everybody else is feeling the same way. And I know you are, because I've seen your commitment. And I see Becca's commitment. I hope to get to know everybody else here too. And because we can do this together. It's going to take a while, but I think we can.
Thank you, Dr. Vizano.
Thanks,
And
everybody. I
we
really
agree.
appreciate the opportunity.
You're an inspiration.
A lot of work to do. Dr. Bazzano, I have a question for you. Are you open to some questions from the audience for the last 15 minutes here?
Of course I am. Yes.
Okay. So I
received
received 2 during your presentation. I'm gonna start off with one. If you guys think of any questions, feel free to type it in the chat and we will offer that up to Dr. Bazzano. So the first question that we received was, do you have any advice for our health messengers with us today on how to be effective advocates for their own health?
Thank you. There are some, I'm so excited to talk to our health messengers. The first piece of advice I would have is about self-care, especially during COVID. We know that all of our athletes, many of our athletes are feeling isolated, more isolated during COVID, maybe getting out of the typical habits, maybe not sleeping as the same or eating differently. And I would say as much as you can to give yourself compassion and to keep yourself structured in your own habits so that you have those healthy habits. That's going to help with your own self-care so that then you can give to others. I'd say that's the first thing. I think the second thing is communication. So whether you're communicating with a healthcare provider, whether you're communicating with a program, making sure that the other person understands you and that you understand the other person and that you're being listened to and actually having the confidence to ask whether the other person understands, just to develop those communication avenues, I think is really, really important. And the third thing is persistence, because I know that you're all going to get doors potentially closed, and that there's always a way, there's always a window, there's always a way around it. And those would be the kind of some areas that I would say, especially when you put all that together. Strong Minds is one of those particular programs that I think is super important for everybody. But for health messengers, especially because you're doing so much very important, very tough and difficult work, keeping yourself grounded is going to be helpful in that. I would tie you into, if you aren't already tied into some of the mindfulness that we do, some of the goal setting that you all already do as health messengers, but this helps to reinforce it.
Yes, thank you, Dr. Vizano. So Becca Henderson, who read your bio, is our health messenger, and then Tyler Griswold is also our other health messenger who is with us tonight.
Hi.
We have one more question from the audience, and it is, what would you like to see in the future for Special Olympics in general and Special Olympics health?
Oh my goodness. So that's a fantastic question. We have 6 million athletes, 700,000 in the US. There are probably 7 million people with IDD in the US and probably about 200 million around the globe. If I had a future that I would see, one is we are a revolution, but we need to grow. And so I would say that if we can grow our revolution to expand, we're, right now we're an amazing force. And I think that we can expand and expand. And the way that I think that we can do that is through really strengthening the local work that we do on the ground. That, like I said, that I was doing in Southern California, and I'm now connecting to Maryland. And I actually do think that technology is going to help us to be able to do that as well. We've seen how that's brought us together during COVID. And I think that it's like tonight. And I think that we can use technology as well as the local part, as well as the technology part, to really reach a lot more people. The other question is, well, once we're reaching those people, what's happening? Are we impacting? Are we changing their lives? Are we helping them to lengthen their lives and have better quality of life? And that's what I think that Special Olympics is and can do through sports, through health, through education, through leadership. So when I'm looking at the future, I see it as, can we grow by 10 times? Can we make a difference to lengthen the life of the athletes and people with IDD? Can we make sure that everybody gets the joy of sport? And I'll just tell you one very quick story. My son has a CP, cerebral palsy, and it was a challenge when he was younger, more than it is today. And I'll tell you the reason that it's not such a challenge today. It's because of sports. It's because when he was young, when he was 5, after years of physical therapy, occupational therapy, and this therapist, and that therapist, and this treatment, and that treatment, he went to a birthday party that was a rock climbing birthday party. And he loved rock climbing. So he started rock climbing. It was the best thing for his hips. It was the best thing for his balance. And then he started doing other things like this. He hasn't been a Special Olympics athlete. He prefers to do some things on his own. But I will tell you, it really is the power of sport to help people around the world. And it's not just people with ID, it's people without ID. So I think that reaching more and making a huge difference in their lives is where we should be going. And then in terms of health, I'm looking at the 4 things that we do. We do fitness and prevention, we do the screenings and the follow-up, we do the training, and we really try to change health systems. And I think we need to go forward on that, expand the reach around the globe, and really get to a place where many more people are having lower blood pressure and being more physically fit and active and having a strong mind. And many more people in the next generation of the healthcare workforce are trained.
Thank you. That was super exciting. I have another question for you. This comes from one of our health messengers. He says, "Hi, Dr. Bazzano. My name is Tyler Griswold. I am a health messenger for Special Olympics. How can athletes get tested for COVID-19?
Hi, Tyler. That's an excellent question. Right now, it's through your healthcare provider or through one of those testing sites, right? So I don't know if you have a phone, if you have even Google Maps, but you can actually even Google right now COVID testing, and it will give you a testing site. There are challenges, though, to do that because, one, it depends on your insurance. They should all cover it. They're all supposed to cover it, but that's one thing. 2 is if it's a site where you have to drive through, you need a car to drive through. 3 is that you kind of need to be prepared for it. So right now, most of the tests are still nasal swabs, and they're deep nasal swabs. And I don't know if any of you has had one. If you have, they're not fun. It hurts to get it to the back of your nose. So you need to be prepared and, not pull your head back while that's happening. And then the last thing is, depending on which kind of test it is, The rapid tests aren't quite as accurate, but they're rapid and they come back in 30 minutes. The PCR tests are usually, they can range from like 2 days to 5 days, depending, to be able to get your results. We have looked into testing, and I'm hopeful. You know, it's still going to be a long time for COVID. I talked to the CDC a lot. They're predicting for most of next year too, that it's going to take a long time, even with a vaccine, for the vaccine to be distributed to everybody. And depending on which vaccine it is, there are 2 doses that you need to take. So it's going to be a long time. So in the meantime, we're trying to look at partnerships that we can develop with CVS, with Walgreens, with other organizations to be able to ease to make it easier for athletes. We haven't quite had success yet, but we're still knocking on the doors.
Thank you, Dr. Bazzano. We have time for one more question. Does anyone have one more question before we move on to our social hour for tonight?
You get a social hour. I love it.
We do. So Dr. Bazzano, we are playing bingo after this, and you are very welcome to hang out with us if you would like to. That will be run by our intern, Maria.
That is so nice. I think my kids are hungry, so I'm probably going to run and get them some dinner cooked. But I really would love to do some more things with you guys. And once COVID's over, I would love to come and join you guys at any competitions, or just to get to know you. It's just, you know, the one thing that I really, really miss being where I am in Washington is getting really close to people who are doing this work locally. I miss it a lot. It's what inspires me, and I hope that I get to do that with you guys, and especially because you're so cool. You're great people.
Yes, thank you. So we have a lot of chats coming through that say thank you